latching hurts. Something is wrong. Breastfeeding isn't meant to feel like punishment. I'm Dr. Nneka. Today, I'm going to be showing you how to get a deep, pain-free latch so you and your baby can thrive and not just survive during feeding. Let's be honest, most of us aren't taught how to latch a baby until we are exhausted, hormonal, and already in pain. But latch is everything. A poor latch can lead to cracked nipples, low milk transfer, mastitis, and early weaning. A deep latch, oh, that's comfort, milk flow, bonding on a whole new level. So let's get down to this, mama, and get you down on a whole new level. But latch is everything. So I'll be introducing Tilly. Hi, Tilly. And I'll be using Tilly to show you, to demonstrate what a deep pain-free latch should look like, okay? So this is Tilly's mouth. And as you can see, Tilly already has her mouth wide open, okay? I'll start by putting Tilly belly to belly with me, and Tilly's nose will be facing my nipple. So this Tilly's nose will be facing my nipple. And Tilly's nose will be facing my nipple. Then Tilly's head should be able to tilt back. So because this is a doll, the head can't tilt back, but if it's your baby's head should be able to tilt back slightly. Okay? Gently tickle your baby's upper lip with your nipple and wait. We want a big, wide, yawn-like mouth. A big, wide, yawn-like mouth. When this mouth is open, then you latch your baby. Bring baby in chin first. When you want to latch, the chin goes in first. So your nipple aims towards the roof of the mouth. More areola will be visible above than below. So you're going to see more areola above and less areola below. That is how to get your pain-free deep latch. So remember, the nose should lightly touch the breast and not buried, so your baby can breathe. So I hope you actually understood a little bit with this illustration. I'm still going to put a visual for you to also understand this better, okay? So thank you, Tilly, for being here and helping mom see how to latch their baby. Thank you. So that was fun having Tilly be a part of this session. So I'm just going to go ahead and tell you the key techniques every mom should know. The chin to breast rule. Baby's chin should always lead. Your baby's chin should always lead. It helps them anchor and open the truth. The nipple aim. Think up and back. Up and back, not straight in. Okay, that gets your nipple to the soft palate of your baby. Then lip check. Are the lips flanged out like a fish? That's a sign of a solid latch. Below, I have downloaded a free PDF guide which you can download and have in your nursing space to help you or help guide you during your feeding sessions to achieve this deep pain-free latch. So, why it might still hurt even when you have done all of this and you're like, I have done this, I followed the step-by-step guide on how to achieve this, but breastfeeding this can still be. Even with the perfect latch, the first few days can still be a sting, but pain that latch through the entire feed, that's a red flag. So things you should check for when this is happening to you is check for tongue tie. You could take your baby to the pediatrician or a midwife. If you have a midwife or a pediatrician, they check if your baby has a tongue tie and they can guide you on how to fix this. You can also check if your baby has thrush, because this can also cause pain during feeding. If you have an engorgement, when your breast is really engorged, it's really difficult for your baby to latch on because it's engorged, like it's heavy, So you have to check that. And if your breast is engorged, you see if you can hand express a little bit before you start the feeding session in order to help you and your baby have a comfortable latch. So your baby can have so in order to help you and your baby have a comfortable latch, so your baby can have good milk transfer. Shallow latch from positioning. Also check the positioning of your baby. Just as I said earlier and I demonstrated, always put your baby belly to belly and head tilted, nipple out, nipple up, head tilted a bit back, just to aim to the palate of your baby. It's also okay to ask help. No mom should suffer alone. Now, let's bust some myths about breastfeeding. There are some questions that real mom asks. Over my years of supporting mothers, I've come through all these questions, and I'm going to answer them one after the other right now. Is it normal if my nipple looks flattened after a feed? Nope. It's often a sign of a shallow latch. Your nipple shouldn't look flattened after a feed. The second question I usually get is, should I feel a tug or suction? Yes, but not toe coiling pain. Not a tug that freeze like, no, not that kind of tug. You're going to feel a tug or suction when your baby is taking in milk, but not a toe coiling pain, tug, okay? The third question mothers have asked is, do I unlatch and try again if it hurts? Absolutely. If it hurts, unlatch your baby and try again. Break the suction gently with your finger and reposition. So do not just pull your baby off the breast. No. That's going to cause a lot of injury and pain to you as well. So you're going to use your finger. Just make sure your hands are clean. Use your finger to break the suction and reposition your baby again until you get a comfortable position to feed your baby. Remember, a good latch isn't just about feeding. It's about making breastfeeding sustainable. You got this, mama. Comment below if this helped your next feed. Hit subscribe for more bite-sized. Comment below if this helped your next feed. Hit subscribe for more bite-sized tips from Latch and Learn. And don't forget to grab your free checklist of 5 signs of a good latch. Just click the link down below. Don't forget to subscribe, share, and come back. Hit the notification button so you can come back for more tips on how to guide you on your breastfeeding journey. Cheers.